Okay, this is Dr. Scott Geller, laser vitreous surgeon, ophthalmologist. In Fort Myers, Florida, we have an amazing patient here who had an industrial accident. You fell off a ladder, was it?
Yes, sir. 16 feet off a roof.
Yeah, and as unluck would have it, you hit the side of your face. You did, aside from many facial bone fractures, which you just had surgery for by one of our most excellent ENT surgeons, Dr. Justin Casey. You can tell him I'm giving him a little plug here.
Nice.
For all the stuff that was going on inside your skull. You also had a big eye floater that was basically dead center. It was basically dead center. What were your symptoms? You had to shake your head to get it out of the way?
Yeah, it seemed that it would float in, and then when I would focus on something, it would kind of just blur the whole thing. And the easiest way to say it would be like when they would blur somebody on TV that was naked. That's what I was seeing.
Yeah, what you had was this fairly large vitreous strand, but it seemed to want to center over the dead center of your visual axis near your retina. So I did one laser session, correct?
Yes, sir.
And the floater is somewhat still there, but it is out of your visual axis.
Yes.
And that we consider a success. So you're a happy patient?
Absolutely. In fact, you were very honest when we first met. You said it would take 2, possibly 3 sessions. And after the first session, about 48 hours later, 75 to 90% of it was gone, to the point where I don't even notice it anymore.
Yeah, and the key to doing laser is to knowing when to hold rather than fold, or fold rather than hold. It's like playing poker. You got to know how, or blackjack. Do you take the hit, or do you just stand?
Yes.
In your case, it was a stand. It's out of your visual axis. Going back in sometimes alters the dynamic in there, and we don't want something moving around. Back to your visual axis, it's good enough.
Absolutely. No, you did a fantastic job. I would recommend anybody that needs it, get in here to see you, because
they have to know that it exists. A lot of ophthalmologists won't tell them, or, well, I heard of it, but I don't know. And sometimes when there's a little niche specialty, I guess you could call it, they're just not aware,
right?
Because they haven't had the experience unless they've seen a patient. And I put these on Vimeo.com and maybe YouTube, and listening to a patient is always better than listening to the doctor. You know, we tend to paint sometimes a not unrealistic picture, but we do paint a lot of hope into it, and based on our experience.
Doc, you did better than what you gave me expectations for. When we first met, you talked about it, and I was very hesitant because I don't want any surgeries, obviously. And when I came in and had the surgery, the results were far better than you had even prepared me for.
That's great, and good luck with the rest of the facial surgeries. I know it's tough.
Thank you very much.
But you still have a good smile.
Thanks.
Without the teeth.